Hi guys, welcome back. If you're somebody who has just turned RT-PCR positive and you're wondering what to do, this is the video for you. Hey guys, thank you so much for sharing and liking all my videos, especially the ones on vaccines. You guys have really encouraged me and motivated me to take a bigger role in helping my city, my country, and people all over the world during this second wave. And if you're somebody who's just stumbled across this video, I'm Dr. Santhosh Jacob, I'm an orthopedic surgeon, and I have been actively treating the COVID-19 from March 2020 in the city of Chennai, Tamil Nadu in India. I believe that information about a disease is the best and the first step we take to overcome the disease. And this video in the middle of the second wave in India and all over the world will definitely empower you to handle home quarantine. Now, before we start, I would like to tell you a few salient points about the COVID-19 during the second wave. First of all, the COVID-19 is no more considered a lung disease or a lung problem or a pneumonia. It is a systemic thrombotic vasculitis. Yes, I know the words are confusing, but let me explain it to you. Systemic is it's there all over our body. Thrombotic is it is a problem with the blood. Sometimes it causes clots. Vasculitis is vascular is blood vessels. It could be arteries which carry the good blood or veins which carry our impure blood, and it causes an inflammation. The reason why the lungs are affected, the first is that our lungs have units called alveoli where oxygen exchange occurs across air into our blood, and hence there are a lot of tiny blood vessels in the lungs, and inflammation in those tiny blood vessels is what has been causing our lung problems. Now that that is out of the way, let us talk about why you should identify your day one, especially if you're RT-PCR positive. The point here is the COVID-19 in the second wave shows a viral phase, which is an inflammatory phase, and an immunological phase where your immune system is reacting. Now, initial symptoms are very mild in the second wave. It could just be a mild fever or body pain. And you have to remember that that is your first symptom, and the day of infection, which is the day one, is 3 to 5 days before that. So if you have had symptoms for more than 5 days, that is if your body pain or your slight fever or cough started 5 days before, and after that you were okay for 3 days and then your severe symptoms started, you have to remember that 3 to 5 days before your first symptom is your day one. And that is important because this virus is progressing quite fast when you cross day 7 or 8. So if you're having increase of symptoms in the second week, you need to really call your healthcare provider and also monitor your oxygen saturation. We will be talking about it later. Now let's talk about my 8 steps with which you can make sure that you are safe in your home quarantine, and also this will help you identify whether you are somebody who needs help or hospitalization, so that you can book your rooms in advance, as all of you know that hospital rooms are not easily available now. And I hope that you will empower yourself with this information to keep yourself and your family safe. So here goes. Point number 1. Get a room, of course isolated. Wear a mask inside the room if anybody is walking in, and also maintain social distance. If possible, get a room with a window so that you have some cross ventilation. I would recommend switching off the AC, but I know that sometimes it could be really hot. So if you want it to be cold, switch on the AC, but definitely leave your room open. It is important even to reduce the amount of virus which is circulating in the air, and clean air is extremely essential for you when you're recovering from a viral problem. Point number 2 is, if you like music, keep it on, because patterns in music you like regulate your stress levels and also help your respiration synchronize, and that is extremely important when you're trying to recover from a respiratory illness. Point number 3, I would advise that if you like going on a plant-based diet. Do it. I know animal proteins are important, but studies have shown beyond evidence that using a plant-based diet reduces inflammation all over the body. And considering that COVID-19 is an inflammatory disease, plant-based diets don't seem like a bad idea at all. Coming to point number 4, here's where it gets interesting. Now, I'm going to tell you how you can monitor yourself or your loved one at home to make sure that they are not worsening and the medications are working. You need to know 3 things. One is oxygen saturation. The second one is the heart rate or your pulse rate. And the third one is your respiratory rate. I will also tell you how to monitor or how to measure somebody's respiratory rate. Unfortunately, you cannot monitor your own, so you have to ask somebody else to do it for you. In order to understand why it is important to monitor these 3, you need to understand what COVID is doing to all of us. Now, just remember this. In the atmosphere, there is 20% oxygen. So with 20% oxygen, our lungs are able to process that oxygen and send 98 to 100% of oxygen to the tips of our fingers. So if it is sending it to the tips of our fingers, I'm saying that because that's where we put the pulse oximeter. We expect that is the percentage of oxygen which reaches all the peripheral organs, even our important organs like the heart and the lungs, because they are end organs and they have very small blood vessels. Now, considering that, what happens in COVID is that our lungs or the alveoli are filled with inflammatory fluid and it is inflamed. As a result, our lungs are not able to process the oxygen and send it as 98% or 99% or anything which is normal with just 20% of oxygen in the atmosphere. And when it reduces, when your oxygen saturation starts to fall, what happens is your heart rate and your respiratory rate first increase in order to compensate the reduction of your oxygen levels. So that is why you need to know that your heart rate and your respiratory rate, when they increase, just remember that even if your saturation is the same, your heart and your lung are working slightly harder. This means that at this point of time, you need to start paying attention to yourself and your oxygen saturation. Because when your oxygen saturation starts to fall further, then your heart and your lung will start to beat a little bit faster, and the normal respiratory rate is around 18 to 22 per minute. The normal heart rate is around 65 to 80 per minute. And if you notice that your oxygen saturation, again, anything above 95 when your RT-PCR positive is considered the green zone, which means you're okay. Anything from 90 to 94 is considered the yellow zone. What that means is that if you have comorbidities like hypertension or diabetes or obesity, or you have some other issue, 90 to 94 is a good time for you to call your doctor, ping him or her and say that this is happening to me, I have comorbidities, should I come to the hospital, and let the doctor decide. If you're below 89, that means that you definitely require oxygen, because at some point of time you're going to get tired of breathing harder and your oxygen levels or your oxygen saturation is going to fall further. So when you see that your oxygen saturation is reducing and your heart rate and your respiratory rate is increasing, you need to call your doctor, and you need to know that clinically you might need oxygen or any antiviral injection with steroids in order to help. Yes, I remember. I also promised to tell you how to measure your respiratory rate. So generally, when you tell somebody that I'm going to see your respiration, they become conscious, and sometimes the respiratory rate is faulty. So what you do is you tell a person that I'm going to check your pulse rate, and at that time you see how many respirations they take in a minute, and that will be more or less accurate. Reminding you once again, 18 to 22 is normal. Anything above 30, you should consider it as severe respiratory difficulty, and you should call your doctor and try to find a hospital right away. Summarizing it up. So pulse oximeter, you know that the green zone is above 95, 90 to 94 is the yellow zone, and below 90 is the red zone, and you need to be at the hospital. And at the same time, even if your saturation is maintaining, but if your respiratory rate and your heart rate are increasing. Now your heart rate 80 is normal. Anything above 90 or 100, you have to consider it as an increase, and that also should warn you that you might need hospitalization or something more like oxygen or something like that. You should be vigilant at this point of time.